pleasure at the National Primary Healthcare Development Agency and the partnership to be part of the collaboration with the Secretariat of the Supreme Council on Islamic Affairs as we work together to bring very important personnel to this conversation around COVID-19 and COVID-19 vaccinations. I want to appreciate the leadership of Barrister Boss Mustafa, the chairman of the Presidential Task Force, who has provided leadership around the processes involved in the coordination of COVID-19 in general, but specifically being the lead in terms of how we make sure that we also successfully deliver on COVID-19 vaccination. I want to appreciate and welcome His Eminence, the Sultan of Sokoto, who has been the torchbearer in terms of ensuring that all stakeholders are brought onto the same page to make sure that there's a common understanding that all of the questions around COVID-19 and COVID-19 vaccination are dealt with in a way that is respectful, in a way that makes sure that everybody that has any question has that questions answered. I want to particularly welcome and appreciate the Secretary General, Professor Loyede, for his leadership, making sure that all of the details that are necessary to help us have a successful engagement were put in place. I also want to welcome all of the ulamas who are present here physically and those who are online with us today for their dedication to their task of making sure that all of the Ummah understand the issues around COVID-19 and COVID-19 vaccination. Today, as a precautionary measure, for the common man in Nigeria, it's difficult to really assimilate what the difference is between stopping vaccination and pausing vaccination as a precautionary measure. The good news is that yesterday, the umbrella organization that is responsible for regulating vaccine and immunizations in Europe, the European Medicines Agency, clearly finalized their investigation and came out with a report yesterday that it is safe to take AstraZeneca and that there has been no cause and effect relationship between vaccination with AstraZeneca and the blood clotting disorders. That is very massive and a very welcome development. The only challenge there is that bad news travels very fast. So for all of the people who have gotten the information that there was some remote or potential link between AstraZeneca and blood clotting, not everybody will get the information that the European Union, the regulatory body, has now reversed and provided clarity and validated that the use of AstraZeneca is safe. So bad news travels very fast, but when there is good news, not everybody gets access to it. But it is very important and instrumental that a day after the European Medicines Agency cleared the air on the linkage between AstraZeneca and blood clotting, that we're meeting here today to deliberate further and really have a golden opportunity to ventilate ideas, ask questions, and have these questions responded to by our very eminent facilitators today. So I want to end my remarks by really appreciating all of the efforts that people have taken to come from far and near just to have this conversation in the interest of all Nigerians. I thank you very much, and I wish each and every one of us successful deliberations.
highly respected ulama, Assalamu alaikum wa rahmatullahi wa barakatuh. This blessed Friday morning, we give all the appreciation and glory to Almighty Allah subhanahu wa ta'ala, our creator, our sustainer, for bringing us once more to Abuja and to this conference hall for this dialogue. We thank Almighty Allah for bringing us safely from various destinations across the country, and we thank Him for making it possible for us to be part of this gathering. A couple of weeks ago, when this hotel, this venue, where issues on COVID-19 vaccination or vaccine were fully discussed by experts, questions asked by common people like us who are not in the medical profession. Answers were provided by the experts, and at the end of the session, we all felt there's still a lot to be done. And we requested all to go back to our various constituencies and discuss these issues more and try to get more issues of concern as regards this particular vaccine. And we then fixed another time to come back for further deliberations. And a date was fixed. And unfortunately, that date fixed wasn't possible because Almighty Allah was not the date He fixed for us, but this morning. So we had to shift it to today, and alhamdulillah, we are here. We want to thank the PTF, want to thank the Primary Healthcare Agency and all the leadership there for making this forum possible. Because we believe there must be understanding before any action is taken for it to achieve any positive impact on all of us. And in fact, as Muslims, we know leaders must consult before taking decisions on behalf of those they are leading. So this morning's program is in furtherance of that consultation, because from the time we met last time till yesterday, I think there's still more confusion as regards the vaccine, its efficacy, the various conspiracy theories that we've been hearing or seeing on pages of media and things like that. Because they're all aware, even some European countries, really advanced countries, suspended the use of a certain vaccine. But just some hours ago, 24, 30 hours ago, some countries now said they are reverting. They go back to the use of those vaccines. So all this add to the confusion for the common man like me who doesn't even know how to hold a syringe, not talk of to give injection to somebody. And all of us here, all of you here, we know the roles you play as leaders. Your voices are very, very strong. People listen to you, people believe in you. And we know the impact of social media. We know the strength of communication in the world now. As we are talking now, it's been live streamed. There are so many people who joined by Zoom who couldn't be here, and they are listening to what we are saying. So there's nothing hidden in the world now. And that's why we call on you to be open, bring up all the supposed problems you think your communities, our communities face or will face as regards this vaccine. The vaccine had been rolled out in Nigeria, in some states, in so many states. Some states, they have not even rolled out yet. Some states don't even believe there is COVID-19. But we're all here to discuss some of those issues. We have seen Mr. President publicly taking the vaccine, the Vice President and others. And we expect to see more political leaders coming out openly to take the vaccine. And we believe all political leaders must take the vaccine first before the common man on the street. Because they are our leaders, they have to be protected first. They are the ones leading our country. So they have to be saved first by any pandemic. It's when they are strong, healthy, and alive, they will now lead our country to greater heights. So we believe all political office holders, since Mr. President has led the way, will bring forward themselves and get the vaccine if they so believe in the vaccine. Because as I'm talking to you, there are some people who don't even believe in the vaccine. There are some people who don't even believe COVID-19 exists. But we know it exists because we lost so many of our close friends and family members and whatever. So it's very important for us in the advocacy to let people know, yes, COVID-19 is there. Yes, there's a possibility of getting out of it. But it's left for you to ask questions. If I'm to stand here, I will continue talking for the next 1 hour because I have so many questions too to ask. But I might be judged wrongly by the media that I have said, whatever I have said will mean is the position of either the Muslims or my own self. So I will reserve my questions and allow you the field day to ask as many questions as you want, as you can. Please feel free to ask questions because whatever is decided here is what you'll go back to our various communities with. But information, in fact, knowledge is power. So many things we don't know, we'll be able to get that knowledge here today. And I don't think after today, we'll need to come back again because time is moving very fast. Time is going. And I don't know whether at the end of this session today, you might still want to request for another opportunity to meet again. But whatever I decide, like I said in my last opening remarks, it's left for you to want to take the vaccine. Because we will not force you, in the sense that when you are hiding in your houses, we will not even come to your house, we won't see you. We only advise you, we only try to appeal to you, like we did with the polio vaccine decades ago, and today we are polio free. There were so many negative comments and reports about polio vaccine then. It was meant to stop our children from producing and things like that. But did it stop our children from producing? Definitely no. Were there side effects of the polio vaccine on our children? Definitely yes, but positively because they no longer have polio. So these are things we need to look at. So we have to look at all these issues on a very clear glass. Let's have no illusions. Things are good or bad, but we listen to the experts. And we want to thank the experts for educating us last time and who are also going to educate us today. And please feel very, very free. Don't hold back any question that you feel you need to ask because the Minister of Health is here, the Executive Director of Private Healthcare is here, and other experts. Ours is to facilitate, and we're here. I want to thank you for coming here for this program. that shows that we are ready to listen, and we are ready to learn, and we are ready also to take positive messages back home. Wish you a safe trip back at the end of this program. May Allah subhanahu wa ta'ala continue to bless us, bless our country, bless our leaders, and take away this coronavirus totally away from us within a blink of an eye. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Sultan of Sokoto, Your Royal Majesty, Royal Majesties here present, the Executive Director of NPACDA, the Secretary of the Nigeria Supreme Council for Islamic Affairs, ladies and gentlemen, I am honored and privileged to be here this morning, and I must thank His Eminence, the Sultan of Sokoto, for helping to see that this gathering comes together as it has come, and also thank our Muslim brothers and sisters for all the support the government of Nigeria has received in our efforts to safeguard citizens from the effect of COVID-19. We are gathered here today to reassure ourselves and to reassure the public that the vaccine we have been using is safe and useful. As you know, several persons, including the President and the Vice and the Ministers, have taken this vaccine. We in Nigeria have not seen any untoward side effect. We have not seen any adverse effect. But we have had reports of effects that were thought to have been connected to the vaccine in other countries, particularly in Europe, which gave reason for some countries to suspend the use of this vaccine, and that of course created concern around the world. That kind of situation is not unusual in medicine. The medicines we are used to Panadol, we are used to aspirin. These are medicines we know very well. But only few of us here will remember or recall that aspirin also has side effects, and Panadol can also have side effects. But we are already so used to the good effects that we do not bother about the side effects. With this vaccine, the good effects are clear, in that it protects us from infection. But because it is new, people are on the alert, and they are on high alert for any effects. So if you notice anything at all, if you cough, if you sneeze, you probably connect it to this vaccine. And if anything happens at all that will have happened even without the vaccine, it is possibly related to it. So when, out of abundance of caution, authorities decide to slow down the use and watch, it is a normal thing also, and it is done only because we are learning more and more about it. But yesterday, many of the countries who had halted the use, or rather suspended the use, have resumed, which means the second bill of confidence in this vaccine, its efficacy and its safety. But before I go any further, let us go back to how we got to where we are. And that was that in the past year, we have had a very challenging period for Nigeria as we watched COVID-19 pandemic and the threat to our capacity to cater to the health needs of our citizens. This is something that the whole world experienced. Although we in Nigeria have lost comparatively few people to COVID-19, Every life lost to this pandemic is saddening. And we nevertheless must thank God for his mercy and for providing us the tools with which we defend ourselves against this vaccine, against this infection, against this virus. And this COVID-19 vaccine is the latest tool that we have to protect ourselves against this illness. Again, for those who value the power of God, we must thank God for showing us the way out of the peril by endowing the learned ones among us with the skills and knowledge and resources to seek and find solutions to this COVID-19 infection within such a short time. Again, I believe that we can see God's hand in the process that led to a vaccine being developed against an infection within 1 year, when normally it takes up to 4 years or more, or in fact it takes more than 4 years. So therefore we can, with every sense of correctness, take this vaccine as a gift from above, the vaccines against COVID-19, and to ensure that our people are protected when it is their turn to take this vaccine. This vaccine is delivered free of charge, and it is being delivered in phases. I assure you that all eligible Nigerians will get their vaccination. It is going to roll out in 4 phases to align with the planned arrival of vaccines from abroad in batches. And each phase targets a specific segment of our population to ensure equity and that it goes round. Health workers are prioritized. Why? Because they're the ones exposed to the disease. They're the ones who take care of those who are sick in the hospital. They are the ones who have to provide for those who are suffering from the infection, while they themselves are healthy. And therefore, by doing that, they are exposed to certain risk in the course of their daily work. So it is fair that they will be the ones who want to protect first, because every one of them that falls sick means one less caregiver. And it is this tactic that is used all over the world to protect our caregivers and everyone else who may have had contact with the caregivers. The next in priority for delivery, immediately close enough, are those who can suffer can suffer very severe disease if they become sick or infected. And these are generally the elderly persons among us and persons who have other diseases, as we have found out, those who may have obesity, diabetes, hypertension, kidney disease, lung disease like asthma. They are at risk of serious disease, and therefore they are prioritized to get this vaccination. Unfortunately, there's been a lot of misinformation about this vaccine in the public, but I want to assure you, as has been confirmed by European Medicine Agency and also by NAFDAC, that this vaccine is safe. As I said just now, it has been taken by all ministers, the President, the Vice President, leaders of the Senate, and Speaker, to confirm to the world that yes, we have taken it as citizens can take it. And I'm also glad to note that our religious and traditional leaders have also endorsed this vaccine, as have many foreign ambassadors, foreign embassies in this country who have come to us and say, we want this vaccine because we cannot go back to our country to take it. They have also taken this vaccine here. A lot of foreign, even European ambassadors and people from foreign missions. So this vaccine that definitely passed all the quality and safety tests by the World Health Organization and NAFDAC. WHO has endorsed it. Just yesterday I spoke with the country representative and I asked him, what is the situation with vaccine? AstraZeneca, and he says, be clean bill of health so far. But we all continue to watch because the nature of science is to continue to observe, to continue to ask questions, to continue to take notes, to examine, to find improvement. And we are not stopping at AstraZeneca. We are not saying that that's the last card. We are saying that this is the best we have so far. Until there's something better, this is what we are using. It's working for us. Now, this AstraZeneca vaccine was received from the COVAX facility early in March. And it is one of 4 in the world, one of 4 that have received emergency use authorization from World Health Organization. And it's also endorsed, as I said, by NAFDAC, who have all conducted independent tests and declared it safe. The AstraZeneca vaccine we are talking about is being used in over 70 countries today, in 6 continents. There have been no serious side effects, only side effects that have caused some alarm, which, as we have seen or been told, they are not directly or surely or independently traceable to the vaccine itself. So, about 70 million doses have been administered, and it was noticed that certain adverse clotting we talked about occurred in 37 people out of 17 million. That's a very small number. Nevertheless, science is correct to investigate and look into it. And the European Medicine Agency haven't declared it safe. It is worthy to note that many countries have resumed using it. The vaccines are our national assets, and they are to be valued by all Nigerians. Although the NPHCDA and state governments have put measures in place to ensure the security, we want to ask everyone here to be vigilant about its use, about its safekeeping, and to report any unusual activities to the police or to NPHCDA or to the Ministry of Health.
Morning all. The Secretary to the Government of the Federation and Chairman of PTF, His Eminence, the Sultan of Sokoto, and President General of Nigerian Supreme Council of Islamic Affairs, the Honorable Minister of Health, His Royal Highness the Sheikh of Borno, and all other Royal Highnesses here present, the Executive Director, National Primary Healthcare Development Agency, the Secretary General, Supreme Council of Islamic Affairs, distinguished scholars and imams here present, distinguished ladies and gentlemen, good morning. Sir, the Honorable Minister of FCT has directed that I represent him here as he has to attend to an equally important national assignment. Sir, as we are all aware, Nigeria got its first batch of AstraZeneca vaccine on the 2nd of March 2021 and flagged off its administration at National Hospital on 5th March 2021. Immediately after that, our dear President and the Vice President took turn and got vaccinated. Our Minister FCT and the Minister of State also got vaccinated immediately after that. That followed with the vaccination of our traditional leadership and religious leadership in the FCT. One of Abaji, who is here present, got vaccinated on Monday. And Dr. Kabir and the Secretary General of Khan were also vaccinated the same day we flag off. All this is to assure FCT residents the safety of this vaccine and to encourage them to take this vaccine. To drive the vaccination campaign and ensure successful completion of the exercise, FCT administration established a vaccination pillar in its National Emergency Operations Center. The target is to ensure that we vaccinate at least 70% of our population to ensure we get herd immunity. This feat is not going to be possible without sensitization of the people, especially in the face of massive social media conspiracy theories. So it is a very pleasant development when I was directed to represent the Honorable Minister at this very important second sensitization program on COVID-19 vaccination. I'd like to encourage all well-meaning Nigerians, particularly FCT residents, to emulate this noble cause. I wish you the very best of this program and pray God Almighty, Allah to reward you your efforts abundantly. Thank you.
We should be sharing the master. The Honorable Minister of Health, Dr. Osage Iheanere, Your Eminence, the Sultan of Sokoto and President General of the Nigerian Spring Council for Islamic Affairs, the representative of the Honorable Minister of the Federal Capital Territory, Your Royal Highnesses, the Shehu of Borno, the Tsunupe, and the Emir of Kefi, the Executive Director, National Primary Healthcare Development Agency, the Secretary General of the Spring Council for Islamic Affairs, our resource persons today, senior government officials from the Ministry of Health and the National Primary Healthcare Development Agency, our distinguished ulamas and clerics, invited guests, distinguished ladies and gentlemen of the press. Before I read my goodwill message, let me assure His Eminence, the Sultan of Sokoto, that we are working on getting all political and strategic leadership to take the vaccines, and that includes our religious leaders and traditional institutions. I am deeply honored and delighted to address our Reverend Imams and Islamic scholars at this critical moment in our efforts to contain the COVID-19 pandemic through vaccination, which is a fundamental part of the COVID-19 containment and national response. On behalf of His Excellency Muhammadu Buhari, President of the Federal Republic of Nigeria, I sincerely acknowledge and appreciate all your support and commitment, which often go unsung. I want to use this opportunity to assure you that your labor will not be in vain. Together, we shall win this war against COVID-19. At this moment, I will particularly want to thank His Eminence, the Sultan of Sokoto, and our traditional leadership and religious leaders for the very active and supportive role that we have received in the course of my management of the Presidential Task Force on COVID-19 in articulating and promoting our national response. Because of the support we have received from you, sir, and other leaders all across this nation, our national response has been adjudged worldwide to be among one of the best. We would not have achieved this if we did not receive the kind of support that we have continuously gotten from you and the leadership of the traditional institution and religious bodies. And for that, I express this morning, Your Eminence, and through you to these institutions my personal gratitude, because if I succeed as the chairman of the task force, a lot of the efforts that brought about this success is attributable to your openness, to your candidness, and to your unequivocal support for what is good for our people and our nation. As you are aware, Nigeria has received its first batch of the AstraZeneca vaccines, which the Federal Ministry of Health and its agencies have proceeded to roll out to the states after Mr. President, the Vice President received their first jab as a demonstration of leadership and faith in the safety and efficacy of the vaccines. I also led members of the Presidential Task Force on COVID-19 to be vaccinated, and all the honorable ministers have also taken this vaccine, and by extension, in the states, governors have led in that regard. Therefore, I commend it to all eligible Nigerians to do same so that we can be protected from this virus. I wish to reiterate that the virus is very potent and people still get infected. It has been reported that some countries are recording a third wave of cases. I therefore urge all Nigerians to recognize that we are not yet out of the woods. The PTF shall continue to emphasize and promote the strict adherence of the MPIs and for people to take the vaccines. Your Eminence, distinguished Muslim scholars and reverend imams, today we have brought the campaign to your doorsteps as we leverage on this divine influence of yours to instill in our people the sense of responsibility for themselves and their loved ones, to wear face masks, observe hand hygiene, physical distancing, ensure protocols are strictly followed during Islamic religious gatherings, and avoiding travels unless absolutely necessary. Another, a more lasting layer of prevention is the COVID-19 vaccination, roll out to enable us achieve herd immunity so that we can have our lives back to normal. As leaders of the Islamic faith and custodians of our people's religious values, have a great role to play in guiding our people aright. The Presidential Task Force relies on science, data, and experience shared around the world to make decisions for Nigerians. Just yesterday, 18th March 2021, the European Union drug regulator said that AstraZeneca vaccines is safe and effective. This was after a lot of misinformation about the vaccine, which appeared on invariably all forms of media, both social, print, and electronic. I believe this has put to bed the question of the safety and efficacy of the vaccine that has been rolled out in our country. The National Primary Healthcare Development Agency, as the federal government agency responsible for all vaccine-related matters, has brought together a highly professional and dedicated multi-sectoral team to drive the process of safe and efficacious vaccinations across the country. I therefore commend Dr. Faisal Shahab and his team at the National Primary Healthcare Development Agency for facilitating this meeting in collaboration with the Nigerian Spring Council for Islamic Affairs. I'm sure that at the end of these deliberations, our imams and scholars will be empowered to mobilize and educate their adherents to take the vaccines. If we are able to take the vaccines and are able to vaccinate between 2021 and 2022 about 70% of our population who would have gotten to the stage of herd immunity. And like I said earlier, we will begin to recover our lives and return to what we have known as the normal way of living. I'm therefore confident that with your support and that of other well-meaning Nigerians, we will overcome this pandemic and restore our socio-economic lives and our family lives and our religious values as we used to know them. Once again, I thank you for listening, and God bless the Federal Republic of Nigeria. Thank you.